Now we want to check the types of depression that we have. There are different types of depression. You may not know the exact one you're actually going through. So we are going to be analyzing the different types we have. We have what we call psychotic depression. In psychotic depression, it means that the person is having depression with psychotic symptoms. Somebody expressing feeling of sadness, feeling of hopelessness, despair, and yet they are misbehaving. They can remove their clothes. They can tell you they are hearing voices. They can be seeing what people don't see. That is what it means to be having psychotic depression. Another one is major depression, when the person is having all the full symptoms of depression, and this will be lasting more above 2 weeks. Another type that we'll look at is called a bipolar affective disorder, when we have two extreme ends of feelings. A time the person will be low, having depressive symptoms. At other times they will be having a very excitable mood. We call them manic phase and depressive phase. At this phase, when they are having the depression, they will be low. If you give them medication too much, you just see the other side coming up. They will be so excited. They will be having all the other symptoms of mania. Apart from this bipolar, we have what we call seasonal depression. This seasonal depression, you will realize that when people have it, it is common at a particular weather than the other. It is common during falls than in winter. And beyond this, another type of depression that we can actually look at is called postpartum depression. In postpartum depression, it is associated with somebody after birth. A woman just gave birth. Between the period of 2 weeks after birth, that moment the person gave birth, to a period of 6 weeks. During that period, it can still extend to about 3 to 6 months after birth, when they are now having these symptoms, and you ask questions while interrogating or trying to do your consultation, you were able to find out that they just gave birth. So automatically that person is going through what we call postpartum depression. Now we have premenstrual depression. Yes, you may be experiencing that, or you may have someone who experiences that. When they are about to start their menstrual cycle, that is when all the symptoms of depression surfaces, and immediately after their menstrual flow, they are back at their normal self. All this feeling will disappear, even without using medications in some cases. And on the last note, another type we'll look at is depression due to other diagnosis, other ailments. Take for example, somebody is diagnosed of having cancer, or somebody is going out, want to look for what they want to eat, and they have an accident and they broke their leg, or they are told at the end of the day that their legs will be cut off. The feeling of how am I going to stand on my feet again? How am I going to go to work? Am I going to be depending on people to feed me? How will I be able to carry out my daily activities? It is at this point that they drift into depression, when they are not able to manage that situation. So it is that diagnosis of another condition that pushes them into having depression. And please, when you go to greet someone, probably where somebody is going through an issue, they lost a loved one or something, we usually tell them that please don't think so that you not have hypertension. I want to let you know that it is not only hypertension one can have when they have any uncomfortable or unpleasant situation around them. They can either drift into having hypertension or drift into becoming depressed. For all of you that loves all our content, please click on the follow button. We need you to follow us so that we know that we're reaching more people. Subscribe to our YouTube channel. Follow us on all social media platforms so that we know that we are really getting at you. But if you don't follow us, you're telling us to stop what we are doing, and I'm sure you don't want that. For anybody who has any condition around you, not only do we create content, we attend to psychiatric medical conditions. As much as we do speaking engagement, if you have your gatherings, call us so that we can come and speak to people and enlighten them on mental wellness. This is where we're going to be stopping today. Watch out for our next video, where we still continue on this same series called Depression.